Emergency response. So this training is called Emergency Response, and it's designed to give new staff basic knowledge before undertaking the formal emergency first aid training and competency assessment, which will occur at a later date. There will be no certification of this course, but it will be signed off in your induction paperwork. This course covers the following first aid situations: so unconscious casualty who is breathing and unconscious casualty who is not breathing. It will also cover choking, severe bleeding or hemorrhage, burns and falls. By the end of the course, participants will be able to respond to any unconscious or conscious casualty using the first part of the doctor's ABCD drill. You know the location of emergency aid equipment, first aid equipment, and how to retrieve it. You understand what actions need to be taken after an incident. So in the full first aid training, I teach the very first thing that you do in any emergency situation is to start thinking about implementing this doctor's ABCD. So it stands for danger, response, shout, send signal for help, open the airway, check for breathing, call 999, start compressions, defibrillation. So I'll go over this in more detail, a lot more detail, in the formal first aid training, but this course is just to bridge that gap between now and having a formal training. There are registered nurses on the shift, and all of the care assistants who have been there for some time have all received the training. So this is just to bridge the gap for yourself. Okay, so we're going to cover the first 3 letters of this response. So if you come into any situation, emergency situation, then the first thing you need to do, you need to stop and you need to assess for danger. You're making sure that the area is safe before you can approach the casualty. So you need to look all around in the environment for any danger, for yourself and for others. Only approach the casualty or intervene if you deem it necessary to do so. Dangers can include like live electrical cables, broken glass, smoke, flames, trip hazards, a violent person, etc. If you identify a danger, if you can manage it yourself, then you manage it yourself, such as like broken glass or a trip hazard. If it's something that you can't manage, such as electricity, you stand back, you can raise the alarm and press the emergency call bell, shout for help, but you make sure that nobody goes near the casualty and that you hand over the danger to the registered nurse who attends, and they will decide how to manage it. Once it's safe, you can then approach the casualty and check for response. So that is what the R stands for, response. So we're going to do something called the shake and shout. And you're going to shout in each ear, open your eyes, just once in each ear. And even though I call it the shake, you're more pushing the shoulders. So it's a very simple thing to do, shake and shout for response. If there's a response, obviously talk to them and you'll decide what to do next, whether you're going to press the emergency call bell or how you're going to handle it. Okay, but if there's no response, the next thing you're going to do is you're going to shout for help, send for help, and signal for help. So the way we're going to signal for help is by pressing the emergency call bell, which is where you press the call bell point. We press both buttons at the same time. Now you do all 3 so that you've got, if there is someone just outside the room, they immediately come in. If there's someone with you, they can immediately get emergency equipment and the nurse quicker to the location. And the emergency call bell will be the best to notify everybody that there's an emergency and the location, but the first 2 might be quicker. And also if one fails, you've tried another 2 methods. If you're outside a nursing home, at this point you will get someone else to call 999 if they're not responsive. The next thing to do, just going back to the emergency call bell. So there's 2 buttons at the same time will activate the emergency call bell. So if you're not in the emergency situation yourself, if you hear the emergency call bell, you stop what you're doing, you make the service user safe, and then you walk to the closest call bell display, and you see where the emergency is, and you walk safely to that emergency. Okay. If you can't stop what you're doing because it will render the service user in an unsafe situation, then you do not attend. It is not the same as the fire bell. The fire bell goes, you have to leave the resident as safe as possible, and you have to attend the fire bell. Okay. This is not the same situation. So if you can't leave them, then you can't leave them. So that is basically the response I'm going to teach you. That's going to bridge the gap between now and you having a formal training. Some of the emergency equipment. So we have the automated external defibrillator, abbreviated AED. For emergencies, we will call this the defib, just so it's easy, quick language to use in an emergency. We don't want to be using long, complicated sentences. So that's the defib, and in a nursing home, that is at the base of the stairs. Now, you may be asked to get that if they're not breathing, because that means they're in cardiac arrest, and defibrillation is going to be the definitive treatment for cardiac arrest. Just a note, you do not need to have any formal training to use a defibrillator. So if there's someone has a cardiac arrest somewhere out in the public, if you know there's a defibrillator, or you can ask for a defibrillator, but you've never been trained to use it, you can just get it and put it onto the casualty. Just open it up and it will tell you what to do. The nurse may ask for the emergency grab bag. So that's the red bag that is in the what we term the nurse's treatment room. The code is C123. It has a suction machine in there that should be charging at all times. So you need to disconnect that charging lead and then walk with it to the casualty. Do not use either the lifts, just in case they do not work. And it's about 13, 14 kilograms, which should be manageable for all of the staff. So that is what we mean when we talk about the grab bag. There are also first aid kits around the nursing home, upstairs upstairs on the landing, in the new wing treatment room, what we call a treatment room. There are these like green see-through first aid kits. There's also one in the minibus, and there's a blue one in the kitchen. The grab bag also has the same content. So this is what would be used for like a minor injury, and you can see sort of contents, just like dressings, etc. So after any incident, you need to make sure it's reported to the management. We need to record it on an incident form for a service user, an accident book for a member of staff. We need to make sure that the supplies are replenished, because we don't want to come along in an emergency and then we've got dressings missing, or we've got the pulse oximeter from the red bag missing, or the oxygen is empty, because we may need these things to assess people and possibly to even save their life. So if something gets used in an incident, it has to be immediately replenished. Whatever happens could be very stressful, and if this is the case, if you find it's an individual thing, if you find it to be stressful, then speak to the manager. It should be handled appropriately. Maybe you need some time to talk about it, some time off. Maybe it's led to some more serious issues from bringing up past memories of traumatic events. Maybe you need to see your GP, but it should be managed appropriately and sensitively. So that's the end of the training, and then hopefully that bridges the gap till you have your formal first aid training.